Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started. After years as one of the country's leading breast cancer surgeons, her own experience as a patient led her to completely redefine the way we approach breast cancer, from diagnosis to treatment to prevention. Now, an integrative oncologist and functional medicine physician, Dr. Jenn is on a mission to help women do more than just survive breast cancer. She helps them truly heal. Through her practice, Real Health MD, she's helping women reclaim their health, vitality, and confidence, including restoring the hormones that conventional treatment took away. Her work is especially focused on women no one talks about, the one who's finished treatment, declared cancer-free, and left to figure out what comes next. Dr. Jenn is also the best-selling author of The Smart Women's Guide to Breast Cancer, host of the podcast Keeping Abreast with Dr. Jenn, an international keynote speaker, and the founder of PerfeQTion Imaging, where she is reinventing how we screen for breast cancer safely, compassionately, and without compromise. I am so excited. We are so excited to have you here, Dr. Jenn.
Well, thank you for having me. I've been so looking forward to this conversation.
Thank you for being here.
Wow. So in our pregame talk here, the first thing that struck me was that you said you're on a mission from God. And I would love for you to share with us tell us that story and everything behind that.
Yeah. So I come from a breast cancer family. There really isn't a time in my life where I didn't know about breast cancer. I come from a very big family, and all the women in my family get breast cancer. So growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. I'm really going to date myself right now. She wrote 54 hits in all. She was literally a rock star, literally. Her most famous song that she wrote was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim when Whitney Houston would release that song to the world in March of 1986. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know, because Linda died of metastatic breast cancer 1 month after Whitney released that song. I was 16 years old, and my hero died. Her life, and ultimately her death, gave birth to my life's purpose. And I did the only thing that I knew how to do, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. So I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship-trained breast surgeon in Philadelphia. I became the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And with all the writing on the walls, I did it long enough for my aunt to be diagnosed, long enough for my mother to be diagnosed. And I'm about 15 years into my career, arguably at the top of my career, when I go from being one of the most high-performing people you've ever met to I can't walk across the room because I don't have the breath in my body. And, you know, when your thoroughbred is injured, you figure out what's wrong fast. So I undergo like this 3-day super intensive workup. And at the end of the 3 days, I find myself sitting in the office of my colleague and friend and physician. And he tells me that I need surgery and chemo and radiation, and I'm going to be on lifelong medication. And despite the fact that these were things that I said all day, every day, without hesitation or reservation, I can assure you when these words are coming at you, they have a different meaning. And so the only voice that I heard in that time and space, despite the fact that I am a conventionally trained physician, went to one of the finest medical schools in this country, did a surgical residency, was running an NIH accredited cancer program. I was as conventional as it gets, and yet I couldn't quiet this voice in my head that said, there's something more, go find it. Now, I didn't know what that something more is. I had no idea what that something more was. but that I had this calling, this voice. Now, I call it God. You can call it universe. You can call it whatever messaging that you download from the universe. But this was my wake-up call, that despite the fact that what I believed I was doing was contributing to the greater good, I was not on my mission. And this was my way to get me on my mission. And I refused treatment. My doctor told me that I would die, which is admittedly what I said to thousands of women before me when they asked, what will happen if I don't treat my breast cancer, right? But I couldn't quiet this voice, and I couldn't explain it any other way. And somehow that answer that I had given to thousands of women before, why did this happen? Somehow it's multifactorial and there's nothing you can do. It suddenly became unacceptable. And so I went on this journey, and it was a very selfish journey. This was me figuring out how I was going to heal myself. This isn't me figuring out how I was going to take care of my patients in a better way. This was, how do I live and raise my 2 boys? So God is good. And in very short order, I find myself sitting in a lecture hall. This tall, lanky guy walks on the stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, I'm about 20 years into my career as a physician at this point, still very conventional, my snooty booty self. And all I can think of is, there's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick and I'm there for a reason. So I check my ego at the door and I tune in, and thank God I did. Because over the next 2 hours, not only would he telescope how I was going to heal myself, but he was also going to forecast what the rest of my professional life was going to look like. Because I learned on that day, in that space and time, exactly why I got sick. I got sick so that I could be in that seat on that day listening to this man, who was Mark Hyman, by the way.
Mm-hmm.
I had a feeling that's who you were talking about, lanky and teethy.
And what he would teach me on that day is that in all chronic disease, but certainly in the world of cancer, we are completely focused on the wrong thing. All of our focus is on the tumor, but the tumor's not the problem. The tumor is the symptom of the problem. And, before we got on today, we were talking about a friend and patient of yours who was diagnosed with metastatic disease. Now, we are conventionally trained to say to women with metastatic cancer, like, get your affairs in order, right? There's no hope for you. But actually, that is true if all you do is use the same old conventional methods. But if you do what I was taught on that day, if you instead look at the root of the problem, figure out what's causing the symptom, what's causing the tumor, what's causing that imbalance, what's causing that shift from the chemistry of joy to the chemistry of stress. If you instead do that, you can restore health. You can restore balance. And when we build health, disease goes away. And that's what I learned on that day. And I am a quick start. I get very excited. I'm an early adopter. So I enrolled that day in the Institute for Functional Medicine. I spend the next 3 years just immersed in the study of functional medicine, come out on the other side, get certified, and just know that that's a bell that I can't unring, right? And so I changed my mission. And my mission is no longer to cut out tumors, because that doesn't help anyone. That doesn't change the trajectory of their life. My mission is now to help women know health, sometimes for the first time in their life. And my women almost universally are healthier after breast cancer than they ever were before.
Amazing. I love that story so much.
I'll be listening to that again.
I know. And then sending it to every one of my female patients.
Yeah, which is probably like 80% of my patients.
Yeah.
Wow. So, I mean, dare we go down this? Well, what are you curious about here before I just jump back into it, Megan?
Well, I think it's always interesting when you have a personal story that becomes the framework for how you treat as a provider. And I think you see that a lot in functional medicine, as you know,
sure.
because most of us move there because we're sick and we are looking for answers.
Yeah. There's a lot of pain to purpose in our ecosystem, right?
Absolutely. And I just was reading an article in one of the more popular newspapers that said so-called functional medicine, which really cracked me up because obviously functional medicine is kind of rising up in the attention these days of our nation.
Well, if it makes you feel better, someone referred to me with air quotes around it, doctor, the other day.
Oh, you're an air quote doctor. Nice.
So, my medical degree, my surgical residency, my fellowship, that didn't qualify.
So I think that's my question for you, Dr. Simmons, Dr. Jenn. Why do you think that functional medicine, with everything you've seen it done, with everything that so many physicians are seeing it do for the health, wellness, and health span of our population, why do you think there's so much pushback still for this method of root cause medicine?
Do you think it's fear? I think it's fear. I think doctors are so afraid of what they don't understand. I can tell you, having been conventionally trained, in the first 2 years of medical school, we actually do learn functional medicine. We learn all about biology and biochemistry and physiology. And then the problem is we get to our 3rd year of medical school and they basically say, forget about all that now, right? Stop thinking about that. Unlearn that because it's no longer important. Now I want you to take a constellation of symptoms, name it, right? Give it a diagnosis, and then this is what you're going to use. And so we go from being very, very scientific in the first 2 years and really thinking critically. And then the 3rd year and 4th year of medical school, it's like we're brainwashed. We are, that part of our curriculum is completely controlled by the pharmaceutical industry, by big medicine and big pharma. Completely controlled. They are writing the script. They are writing the narrative. And we don't really have a choice but to go along with it. Because first of all, if you're someone like me, by that point, you're like $250,000 into your education. What are you going to do? Not finish? And also, you're in the system. You don't know any better. You do not know any better. I even went to a medical school. So I went to Jefferson Medical College, and we had a school of integrative medicine. And even then, we were kind of taught that I don't know about those guys. You don't really want to spend time with them. They're a little off the rails. Right? Even then, when we thought that we had a progressive arm of our education, we didn't. Because the old school, the old guard was saying, oh, do you really want to spend time with those guys? They're out there, right? So, and it's fear-based. It's fear. They don't understand. So that medical oncologist that gave your friend and patient the advice to go get her affairs in order because she has metastatic breast cancer, Kelly Turner, do you know Kelly? Have you ever come across her? She wrote she's done a lot of things, but she wrote 2 phenomenal books, Radical Remission and Radical Hope.
Oh, I've heard those books. Yep.
And in these books, she talks about these people that underwent quote unquote radical remission. Now I'm putting air quotes around that because it wasn't so radical. They changed their diet. They changed the way that they moved. They changed the way that they thought. They managed stress. They incorporated meaningful supplements. They avoided toxins and had detoxification practices. They brought in prayer and meditation, and they did a lot of things. It wasn't some spontaneous remission, but her book talks about all of these things that these people had these remissions to have in common. And the other thing they all had in common is when she went back to the medical oncologist and said, like, what do you think of this? They said, yeah, we don't talk about this because we don't want to give people false hope. Like it was some kind of random miracle. And then she's saying like, well, this is thousands and thousands of people who have these same things in common. Shouldn't we be looking into this? No. It's like they're so uncomfortable with it. And that continues to today. I mean, her books are not new. And it's no better today, really. Every single day, it's like Groundhog Day, where I'm having conversations with patients and they're saying, well, I'm about to start chemotherapy. And I never discourage people from doing what they're called to do. I didn't choose to go that route, but that doesn't mean that it's not right for other people, right? Like if you have a lot of cancer burden, I'm not throwing the baby out with the bathwater. There are some things in the conventional medical world that do represent advances and do help people. And some people with overwhelming tumor burden, maybe they need a little help. I do believe that it is very short-term gain and causes problems along with it. But if you're called to do that, I'm not discouraging, right? But the thing is that there are so many things that we can do along with chemotherapy, along with radiation, to make them better and less harmful. And yet, what the medical oncologists and the radiation oncologists are saying is no, because they confuse I don't know with no. And this is a common recurrent theme. They confuse I don't know with no. So they're telling these women not to fast. Well, Walter Longo is at USC doing these clinical trials that is proving that fasting improves outcome when you're undergoing chemotherapy. Why would you tell your patient not to fast?
I
That's
love that statement.
They tell these
well.
patients not to lose weight. No matter what you do, don't lose weight. Why? 80% of them are overweight. So what's happening is that they constantly confuse I don't know with no. And so these women who are coming with solutions, right, with options to make their treatment better. They're talking about fasting, which was made famous by Dr. Walter Longo, and he is doing all of this research at USC and proving that if you fast while getting chemotherapy, you have better treatment outcomes and less side effects. And yet, the messaging that they're getting from their medical oncologist is no matter what you do, don't lose weight, even though 80% of them are overweight to start. And the very best thing that they can do is fast and lose weight. And, that we're talking about supplements like melatonin or medicinal mushrooms, things that are included around the world in chemotherapeutic regimens and in treatment plans around the world. And yet our providers don't know about it. And they just say no instead of I don't know.
Yeah.
Yeah, it's interesting in the healthcare profession how there's a great lack of humility, I think. I mean, I think of when we talk about, God, tuning into God's channel, so to speak, when I've had people walk into my practice and, we're getting to know one another and they say, hey, Dr. Blodgett, have you read this book? And I'm like, no, I've not heard of that. And they say, well, this copy's for you. And I'm like, that's probably a message, kind of like you being in that IFM conference and Dr. Hyman talking and you're like, wait a minute, I have to, tune away from my resistance, my fear-based thinking and tune into possibilities.
Yes.
And I mean, it seems like that's what you've now developed, the career of hope and possibilities, which is so inspiring. I mean, it's something we try to reflect in our practice, and I just think it feels so good.
But the word that you used, humility, I think that you hit the nail on the head, is that many physicians, many providers, I'm not going to just talk about physicians because it goes further than that. It runs deeper than that. They have lost humility and they have lost curiosity.
Mm-hmm.
Yes, absolutely.
And this is a huge issue because when we do that and when we decide that there's nothing new on the earth, we are no longer serving our people.
Yeah. So should we talk about diagnostics?
Yeah.
All right.
You want to talk about something new on the earth?
I would love to know more about how you're approaching diagnostics differently than the conventional approach.
Well, there's no doubt that the way that we screen for breast cancer is broken, right? And sadly, we've known for decades. Our screening program is 100% focused now on the mammogram and has been since the 1970s. And yet, we've known for decades, like 5 decades, that mammograms don't save lives. That mammograms don't do what they were intended to do. They don't do what they're supposed to do. And yet, we haven't abandoned them. There are countries that have abandoned their screening mammography. And so when I get the backlash, that doesn't mean that they've abolished them. If someone wants to go get a mammogram, they can go get a mammogram, but they have stopped their screening programs because they know that screening the population doesn't save lives and it doesn't save breasts. So, and there's mountains of data. This is not my opinion. This is fact.
Mm-hmm.
And why? Can you tell us why?
Yes. So the problem is that what mammogram does is pick up cancers that are very slow growing, that are not aggressive, and that it doesn't impact the ultimate outcome. And what mammogram doesn't pick up are the aggressive, fast-growing cancers. So those are the ones that if we had a way of intervening early with them, or if early intervention with them is meaningful, and right now it's not, then it would make a difference. So, when we look at the mammographic screening program, it's built on this foundational understanding that breast cancer growth is both linear and predictable. So that assumes that breast cancer starts really small, grows to some critical size, at which point it's more likely to metastasize. And if you could find it before that it reached critical mass, you could save lives and save breasts. And it's a very, very logical theory. Mm-hmm. It just doesn't happen to be true. Mm-hmm. Breast cancer growth is neither linear nor predictable. So you can have a really, really, really small tumor that has already metastasized. And so it doesn't matter when you find that. It doesn't matter if you find it at 3 millimeters, 5 millimeters, or 2 centimeters. That is going to be a lethal cancer. So no matter how many mammograms we do every single year, the exact same number of women die of breast cancer. No matter how many mammograms we do every year, the exact same number of women present with aggressive disease. We are not changing the bottom line for women at all, and haven't in decades. We are not changing it. So when we look at the large-scale studies, we can look at the Swedish study, 600,000 women, 300,000 screened with mammogram, 300,000 just doing physical examination and getting a professional examination with their doctor. It's universal health care, so they all have the same access to care and they all have the same kind of care. And the same number of women die of breast cancer in each group. And the only difference between them is if you use mammogram to screen, you're going to diagnose 20 to 30% more cancers. And those cancers represent the overdiagnosed because those women would have never presented. That would have never progressed to the point where it would have caused clinical disease. Those women, their lives would never have been affected by the breast cancer diagnosis. And yet, once we diagnose a woman with breast cancer, we commit her to breast cancer treatment, which is not benign.
So I think we have to pause here for a second, because what you just said, I remember learning about this a few years back and thinking, holy cow, no one knows this. Like we say, some men, they'll get prostate cancer, but they'll outlive the cancer, right? Like it's not going to kill them. They're going to die from something else. I think we have to reiterate this to women. They could have a small tumor in their breast that would never metastasize or impact their life, but they're then being diagnosed and going down caustic, damaging, horrifying treatments.
Horrifying
That would have never been necessary because they are part of the overdiagnosed percentage.
Yes, that's correct. Horrifying. And it's not just one study. I mean, that's 600,000 women. So it's very, very hard to argue with that.
Right.
But
It's a lot.
to come away from that study and say, well, maybe when you're looking at the population in total, that maybe it's not, mammogram doesn't help, but let's look at young women, because maybe we can impact young women. So the Canadians looked at just that. So the Canadian breast cancer screening study was women 40 to 59 years old. And same thing, 90,000 women, 45,000 got mammogram, 45,000 just had physical examination and an examination by their physician. Same exact outcome. The same exact number of women die of breast cancer in each group. And the only difference between them is if you use mammogram to screen, you're going to diagnose 23% more cancers. So we're not saving lives by using mammogram. And I can argue that we are even costing lives because of the treatments for breast cancer, because they are not benign. And we are leaving these women in a horrible way, which is now my current mission, is taking care of those women. But I will add that part of the foundational understandings of using mammogram for screening, part of the goal was to certainly to save lives, which we're not doing, but they also postulated that women would get less treatment, less severe treatment, and we could save breasts. And if we weren't saving lives, but we were saving breasts, I think that is a noble cause. I think that makes it worthwhile, because I will tell you, having been a breast cancer surgeon for 20 years, there is no way to prepare a woman for mastectomy. I'll tell you that those scars run so deep. It doesn't matter how good a reconstructive surgeon you are. It doesn't matter how good a breast you build for those women afterwards. You can never replace what God gave them. And there will never come a time ever again in their lives where they won't remember that they had breast cancer if you do a mastectomy. Never. And so I think that saving breasts is really important. So let's look at the data. What happened to the mastectomy rate when we started to use mammogram for screening? Well, in fact, it went up, and it went up by 20%. So we're not saving lives, not saving breasts. What are we doing? What are we doing? And, not the least of which, and this is what I get taken to task for all the time, it is still ionizing radiation. You cannot argue that it is ionizing radiation. Am I saying that one mammogram is going to cause cancer? No. But who gets one mammogram, right? Like, most women are starting at 40, because those are our current recommendations, start at 40, and they're having mammograms every year until they're 70, 80, 90, right? Like, this is 30, 40, 50 mammograms. And quite frankly, once you screen a woman over 10 years, the callback rate over that time is at least 50%. So they're not even having one mammogram a year. They're having 2 mammograms a year, right? And of course, there's going to be that woman that had her first mammogram and got diagnosed with breast cancer. I am not saying that one mammogram causes breast cancer, so please don't come back at me with that. But what I am saying is that over a lifetime, by using a test that causes cancer to screen for cancer, some of those cancers are going to be caused by radiation, because you cannot argue with the fact that radiation causes cancer. And for anyone who wants that data, come on. I now need to prove that radiation causes cancer. I mean, that data has been proven.
Yeah.
I think Dr. Wren could figure that out when he invented the X-ray. Didn't his wife die of, cancer
Radiation
from being
exposure?
overly radiated because they were practicing all the time? Oh, goodness.
So tell us about this other technology that we have to
Yes,
screen
please.
for breast cancer.
I'm going to tell you that, certainly I opened 2 PerfeQTion Imaging centers. People think I'm biased. You can think whatever you want of me. I want to make the world a better place. I am on a mission. We started this off. I am on a mission from God, and this is what my mission is. I don't believe that we need to sacrifice our health to screen for any disease. I don't believe in exposing healthy women and healthy tissue to put them in harm's way. It doesn't make any sense, especially because the screening population are women who we have no reason to believe that they have cancer. Why would we subject them to something that could actually hurt them? So I have a 3-pronged approach to breast cancer screening. First, every woman should be doing self-breast examination. No one is ever going to know you better than you know yourself. And spoiler alert, every single woman thinks her breasts are lumpy. We just need to own our lumps. That's all there is to it. You need to know what your breasts feel like when they're normal so that you know when there's been a change. And when there's been a change, go and have it investigated. So if you are premenopausal, you're going to examine your breasts on day 7 of your cycle. If you are postmenopausal, you can just feel them on the first or whenever you remember to do it. You don't have to examine your breasts every day. You don't have to become obsessed about it. Just once a month is more than fine. The second thing I'm doing is I'm doing something called the ARIA Tears test. Do you know about this test?
Mm-mm.
So this is a real-time risk assessment of whether or not you have the inflammatory precursors to breast cancer. So it's not screening for breast cancer, it's screening for the inflammatory precursors. So it's measuring for 2 proteins, the S100A8 and S100A9 proteins, that when found in combination at critical levels, predict that you either have breast cancer now or you're at significant risk for breast cancer.
Wow.
So the sensitivity of this, and it's really easy to do. You just put a little tiny litmus paper inside of your lid, close your eye for 5 minutes, take that paper out, send it off to the company. A week and a half later, you get the results.
Amazing. Not even a blood test. You can do this
Not
at
a blood
home.
test, easy, painless, at home, affordable. The test is about $130 if you use my discount.
Incredible.
AURIA.care, and code is DRJENN20, Dr.Jenn 20. So $130 test.
Thank you.
Has a 93% sensitivity.
Wow.
Better than almost any imaging. 93% sensitivity. The specificity is lower. The specificity is 58%, meaning that 58% of the time, if you don't have breast cancer, it will be negative. And 42% of the time, if you don't have breast cancer right now, you're going to have a clinically positive result. But I will say to you that there are no false positives for this test.
Okay.
Because if you have a clinically significant result, you do have the inflammatory precursors to breast cancer. And if you do nothing, 11% will have a diagnosis every 6 months, and another 11% 6 months after that. So what this test is its opportunity. It's your opportunity to actually prevent a diagnosis. And I believe, because this is a very easily reproducible test, I think there's going to be a lot of other manufacturers of this test. I believe that this is going to be the way that we determine in the future who does and who does not need imaging. And I'm actually using it in my practice to determine who does and who does not need imaging. Because I don't think we need to be running off and doing imaging so often, right? It's very anxiety provoking, and I don't want to put people through unnecessary anxiety. Now, if you have a clinically positive test, I tell people, read my book, The Smart Woman's Guide to Breast Cancer. Everything you need for a prevention plan is in there. If you want more help, I developed a breast cancer prevention program, and you can find out all about that at my website, realhealthmd.com. But I think the ARIA test is invaluable, and I am using it 100% of the time to screen for breast cancer.
Okay. How often do you feel like women should be doing that test?
Every 6 months, if you are at increased risk. If you are at average risk, once a year.
Okay, great.
And just know that you can have a clinically significant result, make changes, and have a normal result the next time.
I love that. That's amazing.
Okay,
Do you mean to say that the body is it's capable of healing?
That's exactly right. If we give the body what it needs and take away what it doesn't, healing happens.
Same's true in the mouth. Go figure.
Well, everyone wants to separate, right?
Mm-hmm.
Like everyone wants to silo everything, that the mouth has nothing to do with the heart, has nothing to do with the gut, we are one system. We are one system. We've become siloed because that's how our conventional medical system is built and designed, right? Like, okay, well, if you're having problems with your gut, go see the gastroenterologist. But, if you're also having heart palpitations, well, then you have to go see the cardiologist. And if you're having joint pain, go see the rheumatologist. And if you're having headaches, go see the neurologist. But actually, as it turns out, the whole problem is that you're in menopause and you have no estrogen.
And those people are never going to talk to each other.
They do not.
Those things.
And we're never looking at the root. Correct.
Even the gynecologist isn't trained to recognize that constellation of symptoms. So, speaking of our conventional medical system, we have been so trained to think that we need imaging every year, right? Like that is the paradigm that we've been taught to exist in, right? And I get it. I get it that people feel like if they're not doing some kind of imaging, they're not. It's part of virtue signaling, actually. Like I remember there was this slogan. There's an awesome book by Gilbert Welch called Overdiagnosed. Did you guys ever read that?
Mm-mm.
Oh, you have to put that on your list. Okay. It's an amazing book. And part of the Senate testimonies, someone said, if you're not getting a mammogram every year, you need more than your breast examined. Like there's all this virtue signaling around it and people feel badly. They're scared to not get some imaging. So I opened PerfeQTion Imaging in August of 2024. I have one in Philadelphia. I have one in Novato, California, and I'm opening 50 over the next 5 years. But right now, there aren't that many. PerfeQTion features QT technology. So this is sound wave technology. It's sound waves transmitted through a warm water bath that collects 200,000 times more data points than MRI and creates a true 3D reconstruction of the breast.
That's awesome.
Without pain, without radiation, without compression, without gadolinium. It's 100% safe. It is a lovely experience. I mean, people feel like I designed it to be this way, but they literally feel like they went to the spa for the day.
It's like a boob bath.
Yes, it's like a boob bath.
There's your marketing slogan.
In a beautiful setting. The setting is gorgeous. We dim the lights. We put on meditative music. Most people meditate, take a nap. Like it's a time that's gifted to them that they don't normally have. And it is so unlike the experience that they have had prior to this, right? Because even if you I mean, certainly if you were getting a mammogram, that's torture, right? But even if you were just screening with ultrasound, it's still really clinical and anxiety provoking. And this is not that. I have completely remade it. So I am putting up 50 over the next 5 years because I want everyone who wants access to this test to have access to this test. But in the meantime, if you don't have access, because I get it, there aren't that many, an ultrasound, if you are doing physical examination and you are doing the ARIA tears test, an ultrasound will suffice. My critics will say, well, ultrasound won't pick up calcifications. And to that I say, so what? The overdiagnosis of DCIS and the overdiagnosis of breast cancer is not serving us. We are doing tremendous harm to these women with these non-invasive conditions that would never affect them over their lifetime, and yet we treat them like they have invasive cancer or these subclinical cancers that are being picked up, and these women get this diagnosis. They now have a sign that says, I have breast cancer. And what happens to them is they go through treatment, surgery, radiation, anti-hormonal treatment, and we tell them that they should be grateful to be alive. And they are grateful. But it is very hard to feel grateful when you can't think, you can't sleep, you're anxious, you're afraid, you're depressed, your breasts are deformed or absent, you've gained weight, you don't recognize your body, you've lost your confidence, your joints ache, your bones ache, you have no libido, sex is unwanted and painful. It's real hard to feel grateful when all of this is happening. And yet, this is how we are leaving women after breast cancer. And we're leaving them without options because you'll recognize all of these symptoms as the symptoms of menopause. Now, when you're treated for breast cancer, you're not going through any kind of a natural menopause. You are flung into menopause head first. And the women who go through menopause naturally are given options. Right? They are being given access to hormones, to hormone replacement. Women who have breast cancer are the pariahs. No one will touch them. They're afraid of them.
And they're shamed if they ask for hormone replacement. Just
absolutely
shamed.
Not. Right? Like there is no pause.
No.
They just get a hell no.
What is wrong with you? Why would you put yourself at risk is what my friends have been told. Yep.
Yes. I won't participate in that. Do you want to kill yourself? Right? Like this is what they're told. And yet there's no data to support that. In fact, the data is all to the contrary. Women who take hormones and get breast cancer have better outcomes than women who don't. And women who get breast cancer and take hormones afterwards have no increased risk of recurrence, have no increased risk of death from breast cancer, and have decreased all-cause mortality because hormones protect the heart, protect the brains, protect the bones. It's like...
And offer quality of life. It's just madness.
I think we might be missing something. Well, so... I think we're going to have Dr. Jenn back on
Please.
For another one because I've got a lot of oral health stuff that connects with breast cancer that I'd love to talk about, but being that we're kind of running out of time. And thank you so much, Dr. Simmons, by the way. This has been riveting.
We could talk to you forever. I mean, you're just a wealth of knowledge.
As the son of a mother and a husband to a wife and the father of 2 girls, this is like near and dear to my heart, and it's awesome. And I'm going to be encouraging my entire team to listen to this. This is so good. But to end this today, I would love it if you would share with us, being this is the Whole Health Podcast, how would you succinctly share what whole health means to you?
Yeah. Well, I always look through my lens, but I will tell you that breast health is health. And the same exact things that are going to give you a healthy breast are going to give you a healthy brain and a healthy heart and a healthy gut and healthy skin and healthy bones and healthy joints and a healthy libido, a healthy mood, a healthy genitourinary system. We are all one system. And at the end of the day, health does not happen in a doctor's office or a hospital or a surgery suite. Health happens at home with the stuff that you do every day. And the only person that can make you healthy is you.
Ooh, amen to that.
Oh, I love that so much.
Thank you.
I just want to say I want everybody listening right now to make sure I am promoting Dr. Jenn's book. I think this is some of the most important information you can learn for yourself, for the women in your life, for the women you love, The Smart Woman's Guide to Breast Cancer. This is vital information.
Thank you so much for your time and your expertise and energy and vision. I know you are doing life-changing work, and we are grateful to have had you on the podcast. Thank you.
Well, thank you so much for having me. It was my pleasure, and I hope you come visit me in my podcast studio for the Keeping Abreast with Dr. Jenn podcast real soon.
We would
Thank
love
you.
that. Pennsylvania's on the list now.
Yeah.
Thanks, Jenn. Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.